Nerdy Girl Dr. Amanda Simanek on the ReidOut, MSNBC, November 24th, 2020.
I'm joined now by Olivia Troy, former top aide, I should say, to former Vice President Mike Pence, and Amanda Simanek, Associate Professor of Epidemiology at the University of Wisconsin, Milwaukee Zilber School of Public Health. Thank you both for being here. And Olivia, I feel like just watching those people in the restaurant, in the airports, some of whose masks were falling down under their nose. I'm like freaking out as I'm watching them do it, and just the things that they're saying to justify traveling anyway, even though they're being begged, not to. I see the problem, and I wonder if then what you can see, having worked on the task force, might be the problem for the next step, meaning getting people to take vaccines and follow the directives of a Biden-Harris administration. Let me let you listen to Joe Biden. He did an interview with Lester Holt today. Here's what he said about that.
As we speak, people are ignoring advice to stay home. They're crowding airports around the country right now. You've called for a national mask mandate. How much power as president will you have to influence people in ways you have not been able to as a candidate?
I hope that we're going to be able to have a united voice on the need to mask, socially distance, testing, and tracing. The words of a president matter, and I think it's critically important. I think it's a patriotic responsibility to wear a mask, to socially distance.
Yes, Olivia, the words of the president matter, and it'll be nice to have somebody who's saying the right words. But how much of a logistical challenge do you think it's going to be for President Biden to implement anything, a mask mandate, vaccine mandates, et cetera?
I think it'll be a big challenge, only because we are living in a very divided time right now, and you've seen this firsthand. And this is something that was created by, unfortunately, the Trump administration. And we are seeing the legacy of the policies and the rhetoric that was said earlier on in this pandemic play out firsthand. And, I know that it's the holidays. I know that it's a very hard time. People have been isolated. There's COVID fatigue. But, I'm watching these images in the airport, and all I can think about is I'm going to be praying that these families and relatives and the people they're going to see and each other don't end up in the hospital the next week, because I'm also thinking about the healthcare workers that are really going to be suffering in the coming weeks as a result of the Thanksgiving holiday and these gatherings and this travel, because that's what I think about when I see these people traveling like this and gathering like this. And it just, honestly, it makes me really sad.
Honestly, Dr. Simanek, same here. And I've heard all of the excuses even from people I know that are still traveling, even though they watched my show and they know that we're saying, please don't do it. I mean, people think that getting a negative COVID test, well, we took a COVID test before we traveled. We now know, Vox has a headline saying a negative COVID test doesn't give you an all clear necessarily. Just getting one test doesn't mean anything. You have people who have family in nursing homes and they're desperate to see them. And maybe the people in the nursing rooms aren't fully aware of why no one is visiting them. So people are taking the chance. It's the holidays. They want to see their family who are in nursing homes. They don't want people to be alone. You've got in Milwaukee, nearly 300 Wisconsin nurses died from COVID-19. 4 weeks, 10 times more than the month before. So it's having this ripple effect. And I don't know how else we can tell people, please don't do it. Do you have any ideas?
I think in addition to pandemic fatigue, there's this sort of cognitive dissonance happening, because how can people wrap their minds around not spending Thanksgiving with family when they can go out to a restaurant with strangers? And I think what we just want people to remember right now is that you could have this infection, and 2 days before you develop symptoms yourself, you can pass it to other people. So if you are gathering with family, we really need to be thinking about still maintaining space, wearing a mask to the extent possible. If you can have your Thanksgiving meal outdoors instead of inside, or at least open the windows, that's better. If you can keep the number of people that you're gathering small and the time you spend together short, those are all ways that, we can still mitigate risk while we get together for Thanksgiving. The safest thing is to celebrate with your own household, no question. But if you've already made the decision to go visit family, then please consider how you can basically prevent spreading that infection to your loved ones.
And Olivia, part of the reason that we have bars and some restaurants open and schools open but at the same time trying to get people to do mask mandates, is that, you know, the President of the United States put a lot of pressure on states to open their whole state up. I mean, places like Georgia and Florida followed his example. So the politics has made it hard to do the healthcare.
Right. And, you know, there's a report I saw that came out today from the White House Coronavirus Task Force, and it actually specifically talks about how every situation is different and every locality is different, and how they should be taking mitigation measures individually depending on what's going on in their area. But they're not talking about it. The White House isn't speaking about that publicly. And quite frankly, they should be. If they care about what's happening right now, whether you're a lame duck president or vice president or not, you should be talking about this and telling people wear the mask, and telling those governors, hey, if there's a county that is really suffering, such as my county and, you know, my hometown of El Paso, where the county judge is trying to implement measures. He announced new measures today, and the governor and the attorney general are writing with him about this. And this has been going on for a month. I mean, this is awful rhetoric, and everyone sort of just needs to get on the same page here.
I would agree with
and
that.
Terrifying and sad. Yeah.
You know, the World Health Organization deemed this parallel infodemic happening along with the pandemic, where people are bombarded with mixed messages and correct information as well as misinformation, sometimes nefarious, you know, spread of misinformation. And I think when our public health measures become politically embroiled and it becomes a symbol of your political affiliation instead of science-based decision-making, it really
it's a huge
is undermining the pandemic response.
Absolutely. It's deadly. Absolutely. Olivia Troy, I wish we had more time. Olivia Troy, Amanda Simanek, stay safe. Thank you very much. Have a happy holiday. And still ahead.